Let's get down to business. The One Big Beautiful Bill Act. Federal cuts local impacts. I'm going to dedicate this presentation to my Executive Director, Kelly Allen, and our Health and Safety Net Policy Analyst, Rhonda Ragambe, who did the lion's share of the presentation you're about to see. So let's talk about Medicaid and the Affordable Care Act, some top lines. The total Medicaid enrollment in West Virginia, July 2025, was just over 500,000 people, close to 1 in 3. 82% of Medicaid spending came from federal dollars in fiscal year 2023. I want to say that one more time. 82% of the dollars supporting the Medicaid program in West Virginia are federal dollars. There are two separate populations in Medicaid. There's the traditional Medicaid population, which comes in at like just over $3 in federal money for every dollar we put up. And then the expansion population, referred to as Obamacare, which for every dollar West Virginia puts in, we get $9 back. West Virginia's total state spending on Medicaid, it's just over $1 billion a year, with about a third coming from provider taxes. Provider taxes are kind of a niche kind of policy thing by which hospitals and other healthcare entities pay a specific tax that goes to Medicaid, draw down federal match, which then supports the services that they provide. 17% is the national average, right? So we very much over-rely on provider taxes in West Virginia to fund Medicaid. And the One Big Beautiful Bill Act targets provider taxes for reductions and cuts in ways that are really, really going to hurt West Virginia specifically. Outside of Medicaid, there are about 65,000 or so West Virginians covered by the marketplace. This is where folks can go and get a tax credit or subsidy to provide insurance coverage that they otherwise wouldn't be able to afford. Medicaid is also one of the biggest job creators in the state of West Virginia, if we're just talking nuts and bolts and we're talking economic impact. Non-farm employment growth over the last decade would have been negative if not for healthcare employment jobs, right? That is directly related to the billions of dollars in federal money that has poured in since the expansion of Medicaid and the Affordable Care Act. As these federal dollars begin to get cut, as these new systems of red tape are implemented that kick people off, and those federal dollars just evaporate out of West Virginia's economy, a lot of jobs are going to go with it. And that's not going to be a good thing, because the non-farm employment, the little blue line, has not been doing very well in West Virginia over the last 10 years. Back to the kind of provider tax and how kind of we fund Medicaid in the state budget. We have in West Virginia reduced state budget spending on Medicaid by increasing our reliance on healthcare provider taxes, which is no longer available. One of the things that the One Big Beautiful Bill did is it capped the amount you could tax as a provider tax on healthcare providers, right? And then year over year over year, it makes it smaller and smaller and smaller and smaller, thereby forcing states to take in less and less and less and less and less from that particular avenue, right? If West Virginia had kept up our state budget spending and compensated for inflation, this wouldn't hurt so bad. But as we became more and more reliant on the provider tax, we funded through our state budget Medicaid less and less and less and less. So as the provider tax and that revenue becomes less and less and less and less available, there's really not much for it to fall back on the state budget, right? This is something that the hospitals were very, very concerned about, right? So a lot of the hospital association pushback and a lot of what you saw and you read, and when people talk about hospitals potentially having to close their doors, especially in rural parts of the state, this is one of the big pieces they were talking about, that they were really, really concerned, right? You're going to say, well, we went with this method of funding for Medicaid. We decided to play ball as healthcare providers. The state shrank its commitment to Medicaid in the state budget, relying on this, but now you're telling us this is just not going to be available. It's going to be less and less and less and less and less year over year over year. So this looks really complicated, this particular slide, but my hope is to make a little sense of it. One of the more, I would say, cynical parts about the One Big Beautiful Bill is that it's not implemented all at one time, right? They spread out the damage over a couple of years. But that doesn't mean that there aren't certain things that aren't going to take place rather quickly. As far as the Supplemental Nutrition Assistance Program goes, there are going to be expanded populations subject to work reporting requirements. Immigrants with humanitarian protections are no longer going to have access to federal food assistance. Work reporting requirements have really not much anything to do with work. What they are is a bureaucratic mechanism that forces people to prove to the department that they are holding down a certain amount of work or work-related activity. We've been through this in West Virginia with SNAP. It was a fantastic failure that really only succeeded in kicking people off, not because they weren't trying, but because when you force people to prove that they're holding down 20 hours a week of work or work-related activity, and for instance, if you come from Randolph County, a very, very large, very, very rural county with one physical location for people to do that type of reporting, and you make them do it week over week over week, what happens is that the red tape just becomes insurmountable, and you just end up getting kicked off, right? If you're working at the Speedway, and there are many, many people on the SNAP initiative that work. There are also many, many people who are disabled, but just can't get through the SSDI process. There are many people who aren't just quite old enough. Congress, during the last 6 months, expanded the work reporting requirements to folks up to 64. They eliminated the exemptions for veterans. They eliminated the exemptions for kids aging out of foster care. Anybody knows what happens when a kid ages out of foster care? Most kids, and this comes from social workers I know, if they don't have somewhere to go, get their belongings put in a suitcase if they have one, a trash bag if they don't, and they get dropped off at the homeless shelter, right? And then additionally, speaking of folks who were unhoused, that exemption was also eliminated in the one big beautiful bill, right? And so we're taking all of these folks, including folks who are working for low wages, and we're saying you have to figure out a way to prove to the department that you are holding down 20 hours a week of work or a work-related activity. If and when you can't do that, you're kicked off, and not only are you kicked off, you're kicked off for the next 3 years, right? This is just one provision that's getting ready to take place very, very soon. In West Virginia, when we talk about the safety net, right, when I talk about things like Medicaid and SNAP and unemployment insurance, but specifically Medicaid and SNAP, you don't have to be a participant in SNAP to benefit from SNAP. Think about your favorite grocery store locally in Hardy County or Mineral, or think about your favorite farmer's market. You may not be on federal food assistance, but there's a very good chance that your local grocery store can keep their doors open because federal food assistance provides the difference between operating in the black and operating in the red. This happens all over the country. We have seen this in West Virginia's experiment, very limited experiment with work reporting requirements in 2016, 17, 18, and 19. As we kicked more people off, we saw a precipitous closure, and SNAP approves retailers, right? Kick people off, less places to do grocery shopping, right? And that was under very limited circumstances. This is going to be much bigger and much more damaging. Also, to be enacted quickly, here in November, those 65,000 folks who are enrolled in Marketplace coverage, not Medicaid coverage, mind you, but Marketplace ACA coverage, are going to find out that on average, their premiums are going to go up $1,400 a year. That's if you're fortunate. If you're a household that has multiple dependents and falls into a certain income bracket, it could get several thousand higher. Those premiums will kick in at the beginning of next year. The residential clean energy and energy efficient tax credits are expiring at the end of the year. And at the end of the year, the enhanced premium tax credits, which make that Marketplace coverage affordable for 65,000 people, is going to expire as well. That's going to have consequences that ripple. We estimate, I believe it was 3,600 people just simply are going to be completely priced out of the market. July 1st, there will be new borrowing caps on federal student loans and the elimination of repayment plan options for federal student loans. January 1st, 2027, this is a big one. Work reporting requirements for Medicaid. Our analysis, just to give you an idea for Hardy County has about 1,050 people enrolled in Medicaid expansion. We estimate just about 257 are going to lose coverage through a work reporting requirement. And what does that mean for Hardy County? It means about $1.7 million lost healthcare dollars just within the borders of your county. That can be a healthcare clinic gone. That can really do some damage. Again, it's not that people who receive Medicaid within the expansion population don't want to work. I would propose that the data, and if you go to the Kaiser Family Foundation, they're one of the more reputable researchers on this, kff.org, and you fish around, what you're going to find is that a lot of people who are able and have access to employment who receive Medicaid are working. They're just not making much money, right? What you also find, and this really, really frustrates me with my federal representatives, and kind of the malignment of the poor, right? The mistreatment, and kind of the looking down your nose that comes from our U.S. senators and our members of Congress talking about, well, it's only for the lazy people who refuse to work, right? West Virginia has a much higher average of folks on Medicaid who take care of family members, right? Grandma, grandpa, mom, dad get sick. There isn't the money to put them in a long-term care facility, or maybe they don't want to go to a long-term care. Maybe they want to spend time at home. Maybe this has already been worked out. And maybe older brother or younger sister have had a conversation and they've decided that one of them or both of them in shifts or turns is going to take turns taking care of mom and dad. This is something that I imagine just about every single person sitting here today knows somebody in this situation if you haven't been in yourself, right? We have a much higher percentage of folks compared to the national average in West Virginia who fall into that situation. They're not lazy, and they should be able to go to the doctor when they get sick too. They rely on Medicaid. We have a higher percentage of folks in West Virginia as compared to the national average who are disabled and or ill, but just can't get qualified for Social Security disability insurance, right? Anybody, anyone here know anyone who's had to go through that process? I do. It's not easy, very difficult. Oftentimes it requires the support and the help of a professional attorney. Not everyone has access to that. We have folks going to school, right, who receive Medicaid coverage. We have folks in other situations, and you know, I understand that folks in power in West Virginia don't want to talk about this, but I go back to our non-farm employment growth over the last 10 years. We have entire swaths of West Virginia where there isn't 20 hours of anything to apply for, right? I grew up in the southern part of Randolph County, right? If the season isn't in of its snowshoe, or if timber takes a nosedive, that's about it, right? Those are your two options for about a 60-mile radius in that part of the world. Southern West Virginia, they're predicting that within the next 2 to 3 months, over 1,000 coal mining jobs will just evaporate, just gone, right? I don't know if anyone has visited down there, but that's not good. That's basically their entire economy in that part of the world. So I don't know how anyone could look those folks in the eye with no options and say, well, you're lazy. You don't want to work 20 hours a week. There ain't 20 hours of anything to apply for, right? Taking people's health care coverage away isn't going to help matters, right? It's going to increase suffering on the personal level, and it's going to wreck our economy because those federal dollars provide thousands of good paying jobs across the state. Sorry, I kind of went on a tear there. Yeah. So in October 1st, at the beginning of the fiscal year, October 1, 2027, just as a point of reference, West Virginia's fiscal year goes from July 1 to June 30th. The federal fiscal year goes from October 1 to September 30th. October 1st, 2027, the provider tax caps will start taking impact and settling in, right? And which means states will have less and less and less ability to draw from that particular source to fund their Medicaid programs, right? Well, like I said, if your state lawmakers have been wise and haven't over-relied on the provider tax while simultaneously shrinking the state commitment to Medicaid, that's something you could probably bounce back from. We are not in that situation. We have very much over-relied on the provider tax while cutting corporate taxes and the personal income tax, both of which are heavily skewed to the wealthiest households in West Virginia. And as such, our state budget has gone down and down and down and down, right? So the money's just not there. If we lose these provider tax dollars, the money's just not there to fill in the difference within the state budget. The other thing that takes place in October 1st, 2027 is the cost shift for SNAP, right? So right now, the Supplemental Nutrition Assistance Program, formerly known as food stamps, has always been 100% federally subsidized, right? That's how it started. What the big beautiful bill did was saying, well, we're going to, based on a particular set of data called the error rate, if your error rate, which is not uncommon, it just means either somebody got denied for benefits when they shouldn't have, or they got benefits when they, there's just sometimes things get mixed up. If it falls over a certain amount, you're going to have to pay either 5, 10, or 15% of your total SNAP bill from your state dollars, or you're going to have to cut. And so in West Virginia, that means we're going to probably have to cut minimum 28 million, maximum 84, right? And that doesn't discriminate between seniors, people with disabilities, or children, right? That takes food from everyone. Bottom line, when it comes to Medicaid, it's going to cost us estimated $1 billion a year in federal health care funding. $1 billion for West Virginia. That's with a B. Changes impacting Medicaid. We talked about work reporting requirements. We estimate from implementation through 2034, 50 to 110,000 West Virginians will get kicked off. This is generally speaking because they can't keep up with the paperwork. Increased eligibility redeterminations, right? So right now, in order to qualify for Medicaid, you are required to make an appointment and redetermine your eligibility once per year. That's going to get bumped up to twice per year. So we're going to take an underfunded Department of Human Services, and God bless you if you're here today and you work for the Department of Human Services. You are truly doing the Lord's work, overworked and underpaid. I salute you. But we're going to take 500,000 people and we're going to drop them on you twice a year as opposed to once a year. We have experience with this in West Virginia. After the national state of health emergency was lifted, everyone in Medicaid had to redetermine. 3/4 of the people that got kicked off were kicked off for procedural reasons. They didn't dot an I. They couldn't make time, couldn't get childcare to get down to the department in time. The department was swamped because we have the worst child welfare crisis in the entire country, right? There's a theme here, right? What wasn't in the one big beautiful bill, what was not outright cut, right, was put behind an impenetrable maze of red tape, right? Red tape design. Weaponized bureaucracy is what I call this, right? You design bureaucracy, you design red tape, you make it so difficult for families to get what they're qualified for that they just get kicked off. They just get rolled off. For years and years and years and years, the work requirement conversation was around the infamous, able-bodied adult without dependent. Our reps just went ahead and voted for applying this unnecessary red tape to households with kids 14 and older, right? So now we're taking federal food assistance, away from families who have children in the household. I don't want to sugarcoat this, right? If you have the opportunity to talk to your federal representatives, a great question is, why did you vote to take food from kids, right? That's what it is, right? That's exactly what that provision does. Again, there are outright federal cuts. There is a mountain of red tape around Medicaid and SNAP designed for the exclusive purpose, specific purpose, to kick people off of the program, even when they're perfectly qualified for it. And there is the very unceremonious passing of the responsibility to state legislatures, full in the knowledge that state legislatures don't have the money to keep up or to fund these initiatives, right? These are the three weapons of the one big beautiful bill. And who wins? Well, I'll give you three guesses. You probably don't need it. 80% of the tax benefits go to the wealthiest 10% of the households. I'm going to say that one more time to reinforce, because I don't think anybody here falls into this category. Namely, because you're not a stockbroker or a hedge fund manager from New York or California. But 80% of the tax benefits go to the wealthiest 10%. The poorest 40% of households are expected to see their income decline, with households making $1 million or more will get an average tax cut of $66,000. That's more than the average West Virginia household makes an entire year. It's going to reduce the GDP, reduce wages, and it's going to jack up the national debt by, I believe, $4 trillion. So thank you so much for having me today. I appreciate y'all.